Right, so this is Snowy. Snowy just came into the clinic to do a vaccination, annual vaccination. And on the clinical examination, we noticed that there was, kind of feeling in the bladder that was not normal. So we decided to advise the owner to take an X-ray, and this is what we found. So we can see that the bladder is here, and we can see a lot of stones there. And they are pretty big stones. They measure around 4 centimeters, so they are quite big. And so tomorrow we'll do a cystotomy and we'll remove the stones, and then we just need to monitor in the next few months to see if the stones are coming back. The stones are going to be sent to Canada to check what type are they and if we can prevent this to happen in the future. So this is Snowy on the table, and this is a little dog, Maltese, 10 years old, and she weighs 7.5 kilos. We saw on the X-ray that there was a lot of stones that now need to be removed. Some stones are 4 centimeters, which is quite big, but there are smaller ones. So we are not just going to, the bladder is out. We are going to do an incision in a place where we don't have vessels. So hopefully it will help on the post-op check and the post-op time. So there will be no bleeding after. So we'll do an incision here, and then we'll try to retrieve all the stones that are there, and then we need to take a second X-ray just to confirm that all the stones are out. And we took a few stones already. Now we're going to take probably the biggest one. Here we go.
Oh.
So yeah, that's a huge stone. And, right. So we'll check if there is more to be taken. Alright, so we managed now to place a urinary catheter from the vulva to the bladder, and we are now flushing the bladder to see if there is any little stone left, so we can, with the pressure, come out from the incision we did. And that's what we are trying to achieve now. Alright, so we finished now. We closed the bladder. There doesn't seem to be any more stones inside. So we closed with 2 types of patterns, and we are going to do now a leaking test. So pressure tests to see, so we'll put a little bit of saline inside the bladder and see if there's any leaking on the bladder. So that's what we are going to do now. So make sure that the bladder is properly closed. We are filling it up.
Okay.
You can see that there is pressure there, but nothing is coming out. So we are happy with that, and we are just going to close the abdominal wall and take the final X-ray to make sure that no stones are left. Alright, so now we have the X-ray post-op X-ray, and this is just to confirm that there is no stone. Sometimes the stones can be in the urethra part, but the bladder will be here, so there is no stones, and there is no stones in the urethra as well. So we are happy with this, and Snowy is now recovering from the general anesthesia. Right guys, so this is Snowy. After the stones from the bladder being removed, she's happy with herself, eating well, and she's going home. And hopefully we will try to avoid this to happen in the future. Right?